It was very dark. I was sad a lot. I was angry a lot.
I would actually think that other people could see it in me. So I wouldn't want to be out in the world.
That sense of hopelessness can be just overwhelming.
It feels like I'm waking up in the morning and there's this huge boulder in my bedroom, and my job is to push that boulder up a hill all day long. That's what it feels like. And at night, that boulder rolls back down, rests at my bed, and it's waiting there for me in the morning.
And I remember thinking, why do I feel this way? Why can't I be happier?
Depression is a mood disorder that is characterized by symptoms such as prolonged and deep sadness, decreased interest in activities that once gave pleasure, the inability to concentrate or interact with others, and having persistent thoughts of death or suicide. Depression is a disease. It's not a choice. It's not something one can fix by just snapping out of it, and it can affect anyone at any time.
About 1 in 10 people will experience a depressive disorder in their lifetime. The rate goes up for women, who experience depression twice as often as men.
We could really say that depression is an illness that feeds upon itself, so that if you do have one episode, you have perhaps a 50-50 chance of having a second. Having a second episode increases that risk still further to 70, 80%.
We can break the factors involved in depression down into two major groups: genetics and environment.
Aside from depression running in the family, environmental factors that can cause or contribute to depression include traumatic experience, pain or chronic disease, anxiety, stress, or major life changes.
I had some significant things happen that led up to it. My mother passed away. I changed my job. I decided to move. These are big, life-altering things to go through.
But why does depression happen? And what is happening inside the body and brain of someone with depression?
Depression almost has a neurotoxic-like effect to the brain.
At least 2/3 of the patients who have major depressive disorder end up having elevated levels of circulating stress hormones.
These types of chemical changes in the brain can lead to eventual physical changes in the brain because they affect the brain's primary cells, called neurons.
Neurons are the main cells in the brain that allow you to see, move, remember, learn, and essentially are responsible for all information transfer in the brain and all information storage in the brain.
In depressed people, neurons are affected in different ways in different parts of the brain. Imaging studies have shown that neurons become less active and can erode. The prefrontal cortex is the part of the brain responsible for decision-making, personality expression, and social behavior. The hippocampus is primarily responsible for long-term memory. These parts of the brain often become atrophied and less active in patients with depression, which can affect their worldview.
I looked at things very black and white. Success, failure, hero, zero, positive, on or off. There was no gray.
Another part of the brain, called the amygdala, becomes overactive. This is the part of the brain that controls emotional reactions.
I personalized everything in my life. Any little mishap or problem or situation, if something went wrong, I absolutely believed it defined me.
Depression can also affect other parts of the body. It has been linked to heart disease, fibromyalgia, diabetes, irritable bowel syndrome, stroke, and cancer. People with depression are more susceptible to substance abuse. And people with pre-existing medical conditions who are depressed are less likely to take their medication and maintain a health regimen. But there is hope.
The important message to convey is that depression is a treatable illness. It's an illness that, even when it's at its most severe, can be treated to what we call remission, which means no symptoms at all. And a person then gets back to who he or she was, fully functional, able to enjoy life, able to live life.